Good morning. Today we are going to discuss about the PROMETRIC exam questions. So first question is they have asked to illustrate the shown gross image of the heart. So here we are seeing a gross image of the heart, and the first history they have given is 55-year-old male with long-standing history of hypertension who died of stroke. Selects the following adaptive changes shown in the illustration. So they have given this history. So history we have to note it, history of hypertension, and the patient died out of stroke. So the gross image shows us the left ventricle. Hypertrophy of the left ventricle is clearly visible over here. And one of the complications of prolonged hypertension is the hypertrophy of the left ventricle. So the four options are given here, and out of that hypertrophy is the suitable answer for this question. So we will see the explanation now. So what is the hypertrophy? Hypertrophy is the increase in size of the tissue is called as the hypertrophy. And the causes of hypertrophy is the increased workload or increased hormonal stimuli. So these are some of the causes. And some of the examples of hypertrophy is the hypertrophy of left ventricle in case of prolonged hypertension, and hypertrophy of the urinary bladder muscles in response to the urethral obstruction. So this hypertrophy of the urinary bladder muscle is commonly seen in BPH, benign prostatic hyperplasia. Okay, so these are some of the example of hypertrophy. So hypertrophy is nothing but increase in size of the tissue. So what is a atrophy? So atrophy is shrinkage in size of the cells by loss of cell substance. So what are the examples of atrophy? Disuse atrophy, denervation atrophy, senile atrophy, and pressure atrophy. So these are some of the examples of atrophies. So next is the metaplasia. So what is a metaplasia? So metaplasia is one adult cell type is replaced by the another adult cell type. So there is a mature cell type replaced by the other mature one, not the premature one. So you have to be very much clear. Metaplasia is a reversible process. And the common type of metaplasia is squamous metaplasia and columnar metaplasia. So some of the examples are squamous metaplasia commonly seen in chronic smokers, where you see a squamous metaplasia of normal ciliated columnar epithelium of the trachea, where you see a squamous metaplasia, and columnar metaplasia in Barrett's esophagus. You can see a columnar metaplasia, where the squamous epithelium of the esophagus replaced by the columnar cells. So these two metaplasia are common. So next is the what is a hyperplasia? Increase in the number of cells is called as the hyperplasia. Usually this hyperplasia and hypertrophy occurs together. So some of the examples of hyperplasia is the hormonal induced hyperplasia. So there is a glandular hyperplasia of the female breast during the lactation period and during the post-pregnancy period, and hypertrophy of the uterus during the pregnancy. So these are all the hormonal induced hyperplasia. Okay, so next question is that 65-year female investigated with hypertension and found to have an enlargement of the left kidney. Right kidney is found to be smaller than left kidney. On radiological examination, stenosis of the right renal artery noted. So there is a clue that is given. There is a right renal artery stenosis is noted, and right kidney is smaller than the left kidney. So mention the adaptive changes. So adaptive changes here is the atrophy of the right kidney. We are asking about the adaptive changes found in the right kidney. So it is the atrophy of the right kidney. So explanation given here is the decrease in the size of the organ due to the restrictions of the blood supply. So one of the causes of the atrophy. So third question is a 45-year-old female found to have a pulmonary tuberculosis. So pulmonary tuberculosis. Mention the type of necrosis found in granulomatous inflammation. So we all know that tuberculosis is one of the granulomatous inflammation, And what type of necrosis is seen in tuberculosis? So caseous necrosis is common in tuberculosis. We all know there are different types of necrosis: coagulative necrosis, caseous necrosis, fat necrosis, and liquefactive necrosis. In tuberculosis, caseous necrosis is commonly present. So now we will see what is meant by necrosis. So necrosis is an irreversible process, and it is a morphological changes indication of the cell death in a living tissue following harmful injury. So it indicates the cell death. So what are the nuclear changes are common? So some of the nuclear changes common in necrosis is the pycnosis, karyolysis, karyorrhexis. What is pycnosis? Shrinkage of nucleus with appears shrunken and deeply basophilic. There is a shrinkage of nucleus in pycnosis, and the nucleus will appear shrunken and deeply basophilic. What is karyolysis? Progressive fading of the basophilic stains of the nucleus, and that leads to the ghost nucleus. That is the karyolysis. What is a karyorrhexis? So karyorrhexis is the nuclear breakup into many smaller fragments, that is known as a karyorrhexis. So these are the three important nuclear changes commonly observed in necrosis. So what is cytoplasmic changes? Cytoplasm will become increased eosinophilic in nature. So now we will see what is meant by coagulative necrosis. So in coagulative necrosis, the outline of the dead tissue is preserved, where you can appreciate the architecture of the parent tissue at least for a few days. And usually this coagulative type of necrosis occur in liver, spleen and kidney and heart. So some of the solid organs you can see a coagulative type of necrosis. What is a caseous necrosis? So caseous necrosis is usually seen in a granulomatous inflammation, example tuberculosis and various other fungal infections like histoplasmosis. It is a combined feature of both coagulative and liquefactive type of necrosis. So next is the liquefactive necrosis. What is a liquefactive necrosis? The dead cells are transferred into a liquid viscous mass due to enzymatic release from the leukocytes accumulated at the site of necrosis. So this is a liquefactive type of necrosis, usually occur in the central nervous system. So where there is a ischemic injury to the central nervous system, you can appreciate a liquefactive type of necrosis. So what is a fat necrosis? Fat necrosis, you can see a focal area of fat destructions which affects the adipose tissues. So a common condition associated with fat necrosis is acute pancreatitis. In acute pancreatitis, there is an acute inflammation to the pancreas which cause destruction to the adipose tissue surrounding the pancreas. Another causes are the traumatic fat necrosis, which occur in high fat content tissues like breast and thigh, where trauma can also cause fat necrosis. So fourth question is, a 75-year-old female presented with fever, headache, neck stiffness, vomiting and confusion, and on examinations two signs, Kerning signs and Burzynski signs are positive. So very important sign. And CSF examination revealed bacterial meningitis. And mention the type of necrosis is most characteristics of this abscess formations. So in CNS, what type of necrosis is common? Liquefactive necrosis type. Liquefactive necrosis is common. And the important clinical presentation is fever, headache, neck stiffness, vomiting and confusions. Another important clue is given here is the Kerning sign and Burzynski sign, and the CNS examination shows a bacterial meningitis. So these are all the evidence of CNS involvement, and that gives the liquefactive type of necrosis where there is a ischemic damage or damage to the central nervous system. So fifth is the illustrate the shown microscopic images of the heart. So this is the myocardial tissue. So myocardial tissue, and the history given here is the 65-year-old male hospitalized complaining of crushing chest pain and complicated with hypotension and pulmonary edema. So patient is admitted with the complaints of crushing chest pain and complicated with hypotension and pulmonary edema. So mention the type of necrosis. So coagulative type of necrosis is common in heart. Okay, so that's the explanation for this MCQs. Thank you.